So today I'm down near Godalming in Surrey to meet Dr Rekha Tailor, who runs the Health and Aesthetics Clinic. Now, Dr Tailor is one of the leading cosmetic practitioners in the country. She's an award-winning doctor, she's a member of BCAM, the British College of Aesthetic Medicine, she's a member of the Royal College of General Practitioners, and I want to find out how she gets such lovely natural results for her patients, which is what keeps them coming back, because she's been honing her skills for nearly 20 years now. So come along with me, we'll meet Dr Tailor, we'll watch her doing some of the treatments that are most popular here and find out how she gets those lovely results. I know a lot of your patients come to you by word of mouth recommendations, so
That's right.
Yeah, you must be doing an awful lot right.
Yes. Well, I've been in this area, in this clinic,
Yeah.
for many, many years.
Yeah.
And there are patients who came to me right when I first opened up.
Goodness.
And they still come to this day.
Fantastic.
Yeah. They wouldn't come if they weren't happy, and they wouldn't send their friends and family if they weren't happy. I get a lot of patients that come to me who simply don't understand what is happening to them. And they're seeing these changes on their faces, their bodies, but they don't know what's causing it. So they may have read about a treatment which they might think might be suitable,
Yeah.
but unless we've explored and the patient understand what the problem is, I think it's very difficult to just go ahead and just do a treatment.
Yeah.
I talk to them about all the layers of the face. So we do a full skin analysis. We
Okay.
also do images in various profiles,
Yeah.
so that we can discuss about what we're seeing. Most of us look at ourselves in a mirror. We're only seeing ourselves in 2D. We're
And
not
we
aware.
smile.
Yeah, we don't see ourselves in 3D. We don't
Sure.
see ourselves when we're moving our face. The imaging camera for the skin is really important because it actually helps us to see what's happening beneath the skin.
I find people are often shocked when they see what is going on under the skin.
I mean, I think sun damage and rosacea are particularly quite shocking for patients to
Yes.
see. But there's a lot of treatments
Yes.
that can be done to help with this. I like to prepare the skin before I do any kind of treatments. If you improve your skin quality, it will mean that you get better results, less risk of complications, longer lasting results, better outcomes for the patient. And sometimes people forget what they were like before.
Yes.
And so if you have these images, these baseline images, and you can show their progress, it actually reinforces the importance of doing what they've been, what's been suggested to them. So I have patients over many years who still come to me quite regularly, and I show them their images from such a long time ago, and they look better now than they did.
Wow.
And I have
10 years
numerous,
ago.
yes,
Yeah.
even longer.
What are the kind of things, the smaller things that make a big difference?
Routine cosmeceutical use,
Okay.
medical facials.
Yeah.
So we do hydrofacials, gentle
Okay.
skin peels. If you do that regularly, those are very gentle treatments.
Wow.
And then energy-based treatments can be done as well
Sure.
to give even more results.
Yes. We've got the background, these lights, there's no windows here, so this is going to give a very precise picture which you can get the same each time, can't you? Because before and after pictures can be so misleading, can't they, if they're taken in different lights?
So it's very important to have consistent lighting and also taken from the same angle. So you'll see at your feet, there's a hexagon there.
So I can be on
so we
different-
place you in different positions.
Yeah.
And it's consistent.
This, if I just stand here, this will be rotating me into specific positions.
And the camera will automatically
And this
take
camera.
consistent
Wow.
pictures.
Now, one you've got here is Sofwave, which I know a lot of people are interested in at the moment, because this is ultrasound, but a different kind of ultrasound to HIFU. Can you explain a bit how that works?
Okay, so it's got 7 transducers and they deliver synchronized energy into the tissues.
Okay.
They cover a larger area. It goes to a depth of about 1.5 millimeters into the skin.
So it's fairly shallow compared to HIFU.
Yes, and it doesn't go as deep, so there's no risk of things like fat loss And because it doesn't go as deep, people find it much more comfortable. So you can cover the whole face and neck, which you can't do with some technologies. You get much nicer, consistent results. It is about tightening, firmer skin. It's got clearances for brow lifting, tightening under the neck tightening. So you do see very nice results.
Useful stuff. And what sort of a lift are we talking about? Is it like a millimetre?
It is, just a couple of mil.
But that's still quite a significant move, and anything that actually that's moving and lifting and tightening is really useful. So would you do that as a full face treatment all in one?
Yeah, absolutely. You can do it all in one day. You can treat the full area.
And then how long to get the results?
So results are seen as early as 3 months, and full results are up to a year.
Wow, so it goes on with the remodelling.
To build the collagen.
Just from one treatment?
Just from one treatment. And we can say repeat it every year.
Now you have cool sculpting as well, don't you?
Yes.
Which is a perennial favourite for, it's sculpting small areas of the body really.
These are newer machines which cover a larger area.
Wow, okay.
The actual hand pieces cover 18% larger area. You actually get more fat loss, 27%. Many patients are seeing their results much quicker. You can treat 2 areas with one machine. You can treat 2 areas at one time.
It's a nice one for double chins in the right kind of patient, isn't it?
Not all double chins are because of fat, so you need to first of all check that it is fat. So yes, people with fat in their double chin, they can be sculpted with cool sculpting.
If you want to get your head around what is happening with your fat cells during cool sculpting, these represent fat cells, each of these before treatment. During treatment, they get frozen. These are the blue super cooled ones. And then 12 weeks after treatment, the blue ones will have broken up, been dispersed by the body, and that amount of fat cells, is this a 27% reduction? Will have reduced by that much. So that gives you a visual idea of what's going on. Now, injectable treatments, so these are the sort of bedrock of any clinic, aren't they? The toxins, the fillers, and other injectables like injectable moisturisers and skin boosters, and you also offer polynucleotides.
Yes.
What are they? What do they do? How do they work?
Polynucleotides are essentially small fragments of DNA.
Okay.
And they're extracted from salmon and trout sperm. And then they're actually purified. But then the purified fragments of DNA are suspended in a water-soluble gel, that's what's injected just under the skin. And it has numerous benefits. So as we all age, our DNA can deteriorate. But these fragments of DNA, which closely resemble human DNA, help the cells to repair. So as a result of this, the cells function better. So we're going to make more collagen, elastin, hyaluronic acid. It will stabilize pigmentation. It helps with inflammation. So it helps with acne and rosacea.
Wow.
And it's also an antioxidant. So it helps with the aging process. So it does so many things as compared to something like Profilo. Now, we wouldn't inject Profilo around the eyes because it has hyaluronic acid, so it will retain fluid. Whereas polynucleotides can be injected around the eyes and it's not going to cause those issues. In fact, many people now prefer to inject polynucleotides around the eyes rather than injecting fillers.
But can it help cover dark circles?
Yes, but because it improves collagen and elastin production and the extracellular matrix of the cells, the tissues are much better.
Okay, so let's talk about how you look at the face as a whole when it comes to something like fillers. How do you go about assessing a face for fillers?
I think it's important to look at the face in all directions. Okay, and also in animation, because things change.
Yes.
A lot of people are not aware of what they look like in 3D from different angles. It helps patients to understand what you're trying to do.
So how do you go about helping people understand that if they come in saying, "Doctor, I don't like these lines," it might take a more overall treatment to help them in their face?
Okay, this is where the consultation is really important, talking about the different layers of the face, explaining to people what's happening to the layers of the face, and then actually showing them what's happening to their face. So for instance, volume loss, you know, there are images that we can show people to show what happens to the fat pads on our face as we age, and what the implications of that are. And then we can actually show patients, you know, from their photos, what we can see. And I've never had anybody say, oh, they couldn't see what I'm seeing once I've explained it to them.
Okay, and are you finding people are scared of fillers at the moment? Which I ask because there's all this talk about how celebs are having their fillers dissolved.
I think the problem is that there is a lot of negative press. The treatment isn't regulated, and so there are a lot of people who are injecting who may not understand what is actually happening to our faces, and injecting perhaps inappropriately, causing unusual results which people then don't like and then want to have them dissolved. So filler treatments always is about restoring volume in a sympathetic way. It's not about changing your face, it's just about having you look the best version of you, a younger you, how you used to look. I like to use the Reviness range of fillers. They're made up of high molecular weight hyaluronic acid. That's important because it closely resembles our hyaluronic acid. So there's less cross-linking, which means there's less risk of inflammation. The other thing is the molecules of hyaluronic acid are spherical. If the hyaluronic acid is spherical, there's less surface area, which means again there's less risk of your body reacting to that. And less risk of inflammation.
In terms of the results it gives your patients, what do you see?
So I see results straight away, but the results will last 12 to 18 months.
Oh, that's good.
Which is a good long-lasting result. And with the benefit of less risk of inflammation, I think it's a huge benefit.
And that must be a reassurance for your patients as well.
It is, yes. My patients trust me to choose the correct and best filler on the market.
So what's your preferred range of skincare here?
My preferred range of skincare is Zeo Skin Health. I found it to be absolutely wonderful. Not only is it great at treating different skin issues, but it's a great range of products to use to maintain skin health.
It's all about stimulating the skin, isn't it? You must stimulate the skin to get it working properly.
His products have active ingredients in the right amounts, but he says that if you actually do the job of the skin, like for instance, if you're hydrating your skin artificially, you're actually making the skin more lazy.
It's a difficult thing for a lot of us to get our head around because we've been told to moisturise our skin from the get-go. So how does the skin work to hydrate itself if we're not moisturising it?
Okay, well, we have these cells in our skin called fibroblasts, which actually make hyaluronic acid. They also make collagen and elastin. So as we all age, these cells become lazy. So they're not making as much collagen and elastin, which is why we get lines, wrinkles and pores, and also why we feel dry. And that's why we feel compelled to use moisturisers and oils. So when you start using oils and moisturisers, all we're doing is hydrating your dead skin cells. And actually the fibroblasts detect this, and it actually makes them shut down even more because they don't need to do that work.
Okay, so is it a bit of a learning process to go through taking away that crutch of moisturiser that your skin is like, whoa, now how do I do this?
So we're in this vicious cycle. The more moisturiser you use, the more you want to use it because you're shutting down your cells. So if we stop using moisturisers and supply the cells with the active ingredients, they will start working better. but it does take a few weeks.
Yeah.
That's not very long, 4 to 6 weeks for our skin to acclimatise. So if you repair your barrier function, which these products will do, actually things like your rosacea will improve as well.
Will calm down. Wow.
Yeah.
So that was an introduction to Dr. Rekha Tailor and her work here at the Health and Aesthetics Clinic. And if you would like to find out more detail, if you want to book in for a consultation, click the link to find out more.